how to tackle and deal with idiot syndrome patients, internet-derived information obstructing treatment. More and more and more of these patients are coming now, sir. Dr. Basak and then Dr. Mehta.
So they make an idiot out of us. The whole game over there, they don't know anything. I just had somebody 1 hour back, and he had optic neuritis, young guy, and whatever. So he knows more about ophthalmology than me, that I can promise you. And he had read up a lot more. So nothing, you have to put them to their place very clearly, that I know my job, this is what can happen, and give them more problems. What can happen with any surgery, LASIK, you can lose your eye also. Start with that. After that, they're not going to argue with you. So the point is, every point that they have and mentioned over there, tell them very clearly, this can happen. Yes, of course it can happen. It is mentioned there and it can happen. So don't defy them on anything. And then the relative, actually, the person who's come with that patient, generally knows that this is a normal chucha person and keeps asking questions. Then you converge on to a point where you make them understand the subject. The whole game of consultation is a game of expectation. The first eye, classically, like the previous question corollary, the second eye took more time, it was more painful, I can't see clearly. Almost every single patient comes up with that idea. However, if your first was a difficult case, they'll say second was very simple. So the whole game is the game of expectation. Reduce that expectation. Tell them, yes, this can go wrong, you can get halos, yes, you will get halos. If you use multifocal, if I have used the correct lens, I promise you that you will have halos. Now what? So if you have told them that you are not trying to defy anything, you are just going away with the flow, but are you going to be driving at night throughout the day? Is that your only job that you do, or is it 0.5% of your activity? So if you want vision for 99.5% of your time, 0.5% glare and halo is perfectly fine. This is how they will digest it. So prove a point. This more and more of idiot, and a lot of patients are going to tape what you are saying, by the way. One more thing, these idiots, so-called, are taping silently. So be careful of every word you say. Don't ever criticize anything else. Don't say anything otherwise, even as a passing remark, because that can be used against you. Be clear, look into their eyes and tell them, this is what I don't know. I don't know. You're not supposed to know it. That's it. Very simple.
Dr. Basak, sir, patients who come with internet knowledge, how do you deal with them, sir? And how do you explain what is actually correct? Because some of the things written over there are wrong. They're blatantly wrong because they read blogs.
I think Dr. Himanshu has already explained. So these are the people you can never satisfy, actually. You can never satisfy. So you tell them the truth, whatever today's era in cornea and even refractive cataract, the digital eye strain, the computer uses and all these things. So you ask them and you again tell them, go. So you have to be very careful. You can give them certain website name also. So these are the website, you read there. Don't go randomly by Google search. You go this website, read the article, and then you come. But it is not always easy to make them understand that internet knowledge and this thing are perfect. So it is a very difficult issue in today's era, and mind that the recording part is also a serious problem.
Yes.
Dr. Karan, your take on this?
I just basically tell them, internet is full of lot of knowledge, lot of stuff, but you need to know where you read it from, and there has to be a reliable source. And I would echo what the other speakers have just said. And and I also do add, there's a reason I've spent so many years. And I've not learned everything from Google. It's a lot of information, but there's a reason I'm sitting here. Otherwise, you can sit here, I'll go that side and you treat me, please. But without sounding arrogant.
So I think also as a youngster, I must chip in that don't be scared of counseling and don't be scared of losing the patient. Patients never go. If in my 2 years of practice over here, I've only had one patient who was from Dubai who didn't come back, maybe for travel issues. So don't be scared of losing the patient. If I tell him the truth, he will not come back to me. If he's not coming back to you, he was not destined for you. But it rarely happens. If you're frank, if you're honest, people appreciate that a lot about you.
That's a fear. I think that's what the last question here is. That's a fear in youngsters.
Can I just peep in a second?
Yes, sir.
See, it's for any patient who comes for a cataract surgery or talks all from Google, there's only a question I put him, you know what you suffer from? Yes, cataract. What's your age? 46, 64, 74. You know what all is going wrong in your body? Why has cataract come in? Because you have aged. They can never deny that they are growing old. And they are going to have so many problems other than just cataract surgery. And they link everything with, sir, aapne operation kiya tha. So you got to define that you are aged. That's why you had a cataract. And I'm treating just a cataract.